And let's go across to Delhi, which is the third worst hit state when it comes to coronavirus cases. And the Chief Minister there has tweeted this afternoon that there are no plans for another lockdown in the capital. This, of course, is a different strategy from Tamil Nadu. So, two states with the same crisis, Tamil Nadu, the second worst affected state, Delhi, the third worst affected state, but two different strategies when it comes to handling the COVID crisis. So, with the Tamil Nadu going in for an intense lockdown and the Delhi Chief Minister saying there is no question of a lockdown. But let's go across to Akshay Dongre for an update on this. But Akshay, in what would be seen as huge relief for the residents of the National Capital Region, the authorities from the centre to the state are now giving an assurance that testing in the capital is going to go up, and that now, and I think this is a quote, anyone who wants to get tested will be able to do so. Is that correct? And how exactly will that work out on the ground?
Well, Sarah, let's understand first what exactly the government means by the term testing and anyone can get tested. There are approximately 9 categories that have been stated by the ICMR about who can get tested in the national capital, or rather in the entire country, and who cannot. Earlier we saw that there was an alteration by the Delhi government in the entire guidelines which were issued, and the most sticking point was the asymptomatic patient. Because the ICMR guidelines clearly state that any person who is asymptomatic but was in direct contact with the COVID patient can get tested. So that was changed in the national capital, because the Delhi government said that all the asymptomatic people cannot get tested who were in direct contact. Only the people who have either comorbidities or patients or people rather who have age above 60 can get tested. So that became a sticking issue here between the ICMR and the Delhi government. There was a meeting between the Home Minister and Delhi government officials, after which the Delhi government has clarified that all the ICMR guidelines will be followed. Earlier, Lieutenant Governor Anil Bajal clearly said that Delhi government will have to stick with the ICMR guidelines and does not have to deviate from what the ICMR is stating at this point in time. Also, we saw that there were some labs which were penalized for not following the rules, and they had to stop testing. They also will have to start resuming their work, because the Delhi government is now saying that all the labs will have to ramp up the testing capacity and work at their full strength. But there is also some rules that have been laid out, which include that the labs will have to give results within 24 to 48 hours. Also, they will have to compulsorily use the RT-PCR application that has been issued. So these are certain things that will be changing. But the biggest point here is that most of the patients that are coming across the country are asymptomatic, and at a point in time when the Delhi, the national capital, is also recording some of the highest cases in the country, it becomes very, very important to test anyone who thinks that they have been in contact and have the risk of spreading the virus further to their family members or the people who they come in contact with, Sarah.